Good morning. The committee will come to order. It's got an echo back there, doesn't it? Hey, thanks everybody for being here. It is such a great opportunity for us to be together. And I will recognize myself for 5 minutes for an opening statement. And I just say how important it is we're here today. And I know a lot of times it's nice for us to get out of Washington to come to such a place such as this. And a lot of people see on television there's a lot of sometimes fighting back and forth between the two different parties. But I'll tell you, as we looked at what's going on in recovery, addiction, and doses, we've worked together. And in 2015, we did the Support Act together. And so Representative Tonko here, all of us are here to work together to move forward. And now we're up for reauthorization of the Support Act. A lot of us got here last night and had the chance to very sobering walk around this battlefield and standing where Pickett's charge was. In our John Holcap, I think his name was our interpreter, said 51,000 people over the course of 3 days were wounded, injured, or killed. You know, over 100,000 people every year die of overdoses. And you sit there and try to absorb those numbers as you're watching and trying to imagine what happened here. I mean, the numbers are staggering in this space, this area to a horrible degree as well. And we all work together to try to move forward. And I have a formal opening statement. I'm actually not going to give it. I'm going to submit it for the record. And I want to recognize my good friend, Dr. John Joyce, who represents this area for the remainder of my time. I'll yield to Dr. John Joyce.
Thank you for yielding, Chairman. Thank you for yielding, Chairman Guthrie. And I would also like to thank Chair Rogers, Ranking Member Tonko, for coming to the Pennsylvania 13th Congressional District. The poignancy of being at Gettysburg is not lost on the members of Congress. The battles that we face when we deal with addiction and the battles that families face is an important message to bring home with the great panels that we've assembled here today. As we approach the 160th anniversary of the Battle of Gettysburg, we do recognize that over 7,000 Americans who lost their lives at this site. And remember that sacrifice as we meet on another incredibly devastating issue, and that is the issue of addiction. This is a scourge upon America. And drug overdoses, which in recent years, as Chair Guthrie just pointed out, have taken over 100,000 American lives annually, leaving behind the devastation to family, to friends, to coworkers. As we look as a committee and as a Congress to address these matters, we have to look at the communities. That's what we're here today to do. We want to hear what recommendations, what impact, how the Support Act can be enhanced, how it can be extended. So far this year, we have made progress by passing the Halt Fentanyl Act, which will permanently schedule fentanyl analogs that have been flooding our communities with a deadly substance, leaving death and tragedy in its wake. In 2022 alone, the DEA seized almost 379 million deadly doses of fentanyl, which is enough to kill every man, woman, and child in the United States. And that's just what was seized. That's what we were able to capture. That's not what came through and ended up on the streets throughout the United States. And I am hopeful that this bill will pass the Senate and be signed into law. There's a lot more work that needs to be done in supporting local law enforcement, healthcare providers, and parents who are facing these issues every day with those in the throes of addiction. In 2018, President Trump signed the Support Act into law, which is a comprehensive measure aimed at combating addiction and helping treatment for those facing the disease. Yet despite those efforts and the exacerbated response by COVID-19, we're still seeing those increased deaths, and we must examine how the Support Act can be enhanced, improved, and address the issues that you bring for us today. We must also be examining what policies need to be addressed to ensure that all patients have access to crisis and recovery services and the ability to receive the treatment that they so desperately need. Some of these barriers include looking at the impact of IMD exclusion, which has restricted access to residential and inpatient care, and whether this can be modernized to ensure the availability for the treatment of patients. The Support Act also recognizes that to ultimately be successful in combating the opioid misuse crisis, we must do a better job helping the 50 million Americans who suffer from chronic pain. Pain is a serious and growing disease which is more prevalent in older adults, women, veterans, blue-collar workers, and people living right here in Pennsylvania's rural 13th Congressional District. The SUPPORT Act contains numerous pain-related provisions directing the federal government to promote patient awareness and access to non-opioid therapies. I would like to request that the statement from the U.S. Pain Foundation be entered into the record. Thank you, Mr. Chairman. I yield back.
Gentleman yields back, and I will, I know we're a couple of minutes over, a few seconds over. I just want to say how much, I should have said how much we appreciate the National Park Service for hosting us. You see the men and women in law enforcement that are here making sure we have safe and secure. I know y'all deal with not only these kind of, you don't deal with these kind of things every day, I know, but every day you deal with what we're here to talk about, and we appreciate what you guys do. I will now recognize my good friend from New York, Representative Tonko, for 5 minutes for an opening statement.
Thank you, Chair, and good morning, everyone, and thank you to everyone for joining here for this very important topic. In a special way, a welcome to our panelists. This is a vital hearing, and I thank Chair Guthrie and my colleagues for hosting it. As a co-chair of the Bipartisan Addiction Treatment and Recovery Caucus, I'm all too familiar with the devastating impact of the disease of addiction. This is a loss many of us know all too well. The loss of a daughter, a son, father, mother, a sister, or a brother. A neighbor dying much too young and leaving behind a grieving family. Communities are being ripped apart by poisons seemingly beyond our control. Last year in our nation, there was an estimated 109,680 overdose deaths. That's 109,680 lives lost that impact far greater numbers than we can imagine. Think of how many people that is, every single day needlessly dying and having their lives cut short. Think of the magnitude of all of those impacted by those 109,680 loved ones. For each of those individuals, there's a whole universe of friends, of family, of communities impacted. I recognize that many of our brave witnesses today were brought here by tragedy and by terrible pain. I hope that as a committee and as colleagues and friends, we can learn from their pain and act together with a sense of urgency. This year, with the reauthorization of the SUPPORT Act, we have an opportunity to address the devastating disease of addiction. I think we can all agree there is a crisis at hand. Sadly, in 2021, 94% of people aged 12 or older with a substance use disorder did not receive any treatment. It's a startling statistic, but one that makes it clear there is a massive gap in access to treatment. Over the last decade, I have recognized this gap and have made a focus of advocacy in Congress on knocking out every single barrier to addiction treatment so that when an individual struggling with the disease of addiction reaches out for help, we have a medical system ready to welcome them with open arms. As a committee, I ask that we work together to make access to affordable and quality addiction treatment our highest priority. I'm heartened that as I look across at the members here, I see a coalition that understands the importance of that goal. In this moment, I feel hopeful that together we can find common ground and take that immediate action. During my time in Congress, we've worked together to pass CARA, the SUPPORT Act, and most recently our bipartisan mental health package. These policies have provided billions of dollars to support the American people and combat that overdose crisis. In particular, we have had a lot of bipartisan success when we worked to pass the SUPPORT Act into law back in 2018. Together, we made progress forward in access to and coverage for medications for opioid use disorder. We expanded the providers who can prescribe MAT, and we also created an innovative new demonstration program for reentry that has now been put into action. But we still have more work to do to protect the most vulnerable. 5 years later, it's clear that there is widespread support for good reentry policy. I humbly ask, let's come together and pass the bipartisan Reentry Act, which would be a game changer for reducing overdose deaths and suicides by allowing all states to provide pre-release care to Medicaid-eligible individuals up to 30 days prior to release from incarceration. Sheriffs across the country are calling for passage of the Reentry Act. Medical providers and addiction advocates are calling for passage. Beth Macy, the author of Dope Sick, who has seen this disease firsthand, has called for passage of this legislation. Let's heed their call. I also hope we can have a comprehensive discussion on how to expand access to treatment, including medications for opioid use disorder, such as buprenorphine and methadone. We also should expand access to naloxone, testing strips, and syringe services so that lives can be saved. I also hope that we will take a look at a bill that is called due process. I look forward to discussions over the coming months on how we can support policies to save lives. Addressing the disease of addiction must include a compassionate response, bolstered by the pillars of prevention, of treatment, and of recovery. I also want to thank everyone for being willing to discuss addiction. For far too long, the disease of addiction has carried an awful stigma. Together, by gathering here to openly discuss this, we help share that addiction is not a moral failure, but a disease. And if we treat it as such, we'll be victorious. We can share how recovery is not easy and often not a linear path, but that a life in recovery can be filled with so much hope and serve as inspiration to each and every one of us. We also make it clear that we will not turn our backs on those who are suffering from addiction. We recognize their pain and the barriers that make treatment and recovery difficult. However, when someone has that moment of clarity and seeks treatment, we should have systems in place that move heaven and earth to get people the very best treatment available. So I look forward to learning more from our witnesses here today, and I promise you that I will continue my fight in a bipartisan manner to ensure treatment on demand so that all of those who are suffering from this disease of despair have access to treatment and, most importantly, hope. Thank you. With that, I yield back.
The gentleman yields back, and now we're going to go to witnesses' opening statements. And for those of you who haven't testified before Congress before, you have opening statements. I think you've been told 5 minutes. You'll see a green light, yellow light, red light. So it'll get, I guess, 1 minute out green or yellow, or 30 seconds, 1 minute out yellow. And so when you see red, start wrapping up. Now, this is important, so I'm not going to have a heavy gavel. If you have a thought you want to get out and it turns red on you, just feel free not to stop mid-thought, mid-sentence, but begin to start summarizing if you get to that point. So, but we're here to learn, so I'm not gonna have a heavy gavel on you because I know we have some stories that we need to hear and ideas we need to share. So, with doing that, to introduce our witnesses today, I'm going to yield to Dr. Joyce, and he'll introduce you all, and then I'll call on you each time.
Thank you, Chair. Our first witness is Mr. Mike Straley, founder of Leah's Legacy Foundation. Mike and his wife Robin tragically lost their daughter Leah to opioid overdose after a long battle with substance use disorder. He is the author of The Calling and started, in his daughter's memory, Leah's Legacy Foundation in an effort to help others who are struggling with substance use disorder. Our next witness will be Dr. Mitchell Crawford, who is the Medical Director for Specialized Treatment and Recovery, WellSpan Health, and Director of Addiction Services at WellSpan Health Facilities. Dr. Crawford is a clinical specialist in treating substance use disorders, such as opioids, alcohol, and nicotine, and behavioral addictions as well. Dr. Crawford completed his residency at Harvard South Shore Psychiatric Residency Training Program. Next will be Chief Bill Saravola of the Reading Township Police Department. Chief Saravola has been in law enforcement since 1995 and began his career as a crime scene investigator for the Kenner City Police Department in Louisiana. Prior to his time as Chief of Police for Reading Township, he was Chief and Officer in Charge for Adams County Police Department. Our fourth witness is Ms. Emily Keller. Ms. Keller is the former mayor of Hagerstown, Maryland, and prior to her time as mayor, she served as the Hagerstown City Council. Currently, she is the Special Secretary of Opioid Response, Opioid Operational Command Center, in the Office of the Maryland Governor, Wes Moore. Mr. I yield.
Thank you. That concludes witnesses' introductions. Ms. Keller, we're going to go my left to right, I guess we would say that. So I will call on you first for your 5 minutes for an opening statement.
Thank you. Chairman Guthrie and honorable members of the subcommittee, thank you for the opportunity to participate in today's hearing. My name is Emily Keller, and I am Maryland's Special Secretary of Opioid Response. In this role, I oversee the Opioid Operational Command Center. I come before you today as someone who has been directly affected by the overdose crisis. My life in public service began after seeing my best friend, Ashley, struggle with a substance use disorder for many years as she failed to access the care that she needed. After she lost her battle with her disease, I dedicated my life's work to doing everything that I could do to promote access to care for others like her. I made a promise to her that I would be loud for her, and that is exactly what I intend to do. My story, tragically, is not unique. So many Americans have experienced the same loss as overdose rates skyrocket in our country. About 7 people a day lose their lives to overdose in Maryland alone. Efforts such as the Support Act of 2018 have increased our ability in Maryland to respond to this crisis by expanding support for treatment and recovery services, by increasing access to medically assisted treatment, telehealth opportunities, and advancing public health screening and prevention. In 2021, more than 107,000 people lost their lives due to fatal drug overdose in the United States, an increase of nearly 15% from the prior year. In 2020, Maryland ranked 6th highest in the nation for drug overdose death rates. For those living in rural communities, access to care can be particularly challenging. For those without a car that are living in communities that lack public transportation, this barrier can be insurmountable. The ability to utilize telehealth to prescribe MOUD is critical to help reduce overdose deaths, especially in communities like my own. 1 in 5 incarcerated individuals are currently serving a sentence related to a drug offense. Also, the leading cause of death for people leaving prison is overdose. Maryland has taken steps to try to lessen the risk of overdose for people who are incarcerated by passing the Opioid Use Disorder Examination and Treatment Act in 2019, which requires an array of substance use disorder services be available in jails. While medical services are available in carceral settings, SUD services are rare. Substance use disorder is a medical condition and deserves to be treated as such. We wouldn't deny someone antibiotics if they were sick, so how is this any different? In April of this year, the U.S. Department of Health and Human Services issued guidance encouraging states to apply for a Medicaid Section 1115 waiver, which allows states to use Medicaid for medical services, including SUD services for people otherwise eligible 90 days pre-release. We applaud Congress and HHS for making this opportunity available to states. I am excited to share that Maryland is using this guidance to prepare an 1115 waiver application. Governor Moore is embracing evidence-based solutions such as harm reduction, which can be used as a model nationally. Harm reduction is a set of practices that aims to reduce the severe health impacts associated with substance use. Meeting people where they are at is especially important because all people, despite their circumstances, deserve to be treated with dignity and respect. Ensuring that every person, school, and business has naloxone available is an effective way to fight the overdose crisis. The only thing naloxone enables is breathing, and having this life-saving medication available is key. Individuals who participate in harm reduction programs are 5 times more likely to enter treatment, which is significantly higher than the 1 in 10 individuals who enter treatment outside of a harm reduction program. In addition to providing support services and connections to treatment, harm reduction also includes syringe service programs, which greatly reduces the spread of infectious diseases such as HIV and hepatitis. As we continue to have these conversations and enact policies to help combat the overdose crisis, including people who use drugs in the conversation is essential. Taking a nothing about us, without us approach will do so much good. We want to make sure that people who use drugs have a real voice when it comes to the creation of policies and programs that are created to help or affect them. Governor Moore has vowed to lead with love, and that starts by saving lives. Our priorities include addressing the needs of the individuals that are most at risk for overdose, taking a public health approach to substance use solutions, and leading on evidence-based practices. It also means removing as many barriers to care as possible so that individuals can access treatment and recovery services at the critical times when they decide they are ready to seek help. No one will be left behind. Thankful, the Support Act was groundbreaking in that it was the first piece of federal legislation to truly address the overdose crisis foremost as a public health issue. This approach is critical to addressing the actual and immediate needs of people who use drugs and people with substance use disorder. As the overdose crisis continues to evolve and the number of stimulant-related overdoses increases or new drug trends emerge, such as xylazine, we need to remain nimble in our response effects and ensure policy meets the actual needs of individuals with substance use disorder. Thank you again for the opportunity to address the subcommittee today, for your dedication to this issue, and for the hard work you do on behalf of the American people.
Thank you for being here, and thank you for sharing. And you're mayor of Hagerstown. It's a beautiful town. Beautiful
Thank you.
town. I get to drive through sometimes when I drive from Kentucky. So Mr. Straley, you're now.